Cervical cancer is a cancer that arises in the lowermost portion of the uterus, which is called as the cervix. Cervical cancer is mainly caused, or rather solely caused, by a virus, which is the human papilloma virus. Human papilloma virus is avidly present in the environment, but it's predominantly transmitted through close physical contact. Although it is said that 80% of the world's population can be exposed to HPV, that is a human papilloma virus, at least once in their lifetime, it is not in everybody that it turns into a cancer. In 90% of the women infected with HPV, the virus is destroyed, or it is defeated inside the body by the body's immunity system. Whereas in the 10% of women in whom the virus persists, that is called as a persistent HPV infection, they are the ones in whom the cervical cancer originates. But yes, the cancer does not originate just like that. It goes through a phase of precancerous lesions and later on gets converted to cancer. The precancerous lesions leading to cancer can take to about 5 to 25 years. So generally, when a woman is exposed to HPV somewhere at around in her teens or in her early 20s, she has a chance of developing a cancer, usually in late after 40s, especially if it's a persistent HPV infection. So cervical cancer, which usually used to be a disease seen among the low socioeconomic status, is now not just confined there, but it can be seen anywhere. As I told, it is mainly because of the human papilloma virus, or the HPV, which is essentially the main cause of this cancer. How is cervical cancer diagnosed? Usually in the early stages, especially when they have symptoms, the symptoms could vary from a foul-smelling vaginal discharge, or a blood-mixed vaginal discharge, or intermenstrual bleeding or spotting, or bleeding after intercourse. So these are the common symptoms of cervical cancer, and women who are presenting this, especially in the age group of around 40 to 50, it can be seen in the other age groups also, but in this age group when it is seen, the clinician should suspect that I have to do a speculum examination, an internal examination, and try to take a pap smear. And on pap smear, we may be able to diagnose, but if there is an obvious abnormal looking growth in the cervix, then we take a biopsy from that, we send it for histopathology, and if that is suggestive of cancer, we may do additional testing like MRI and try to see what is the extent of the spread of the cancer. Usually cervical cancer spreads loco-regionally. So in that situation, we then take a call, the gynecological oncologist will take a call whether to do a surgery for this patient or to offer another therapy like a radiation therapy along with weekly chemotherapy. So based on the stage of the disease, so this has to be taken. Usually this decision is made by the gynecological oncologist. In usually first stages, we can operate and try to cure the disease by surgery itself, but many a time, even in advanced stages, even if it's not operable, by giving radiation and chemotherapy, the patient usually gets cured. Once the patient is completed treatment, they will have to be on follow-up every 3 months till about 2 years, and thereafter every 6 months for the next 2 years, and yearly thereafter. So what is the good thing about cervical cancer is that it is entirely preventable because it's caused by a virus. So there are two main ways of preventing it. Number one is primary prevention and another is secondary prevention. Primary prevention is by giving a vaccination. A cervical cancer vaccine is available, and secondary prevention is through screening. The screening is done by a simple test called pap smear. A pap smear is something wherein we use a simple device to just scrape out the cells of the cervix and test them under microscope and see if there are any abnormal cells or atypical cells which can lead to precancer or cancer. It is a painless test which can be done on almost all women after about 25 years of age till 65 years of age. Now we also do, along with pap smear, something called as a HPV DNA assay wherein a combination of these two tests, if done, then the woman does not have to turn up for screening for the next 5 years. So according to the WHO, it says that at least between 35 to 40 years in a woman's lifetime, at least once this test should be done. Because once this test is done, and if the test is positive, it's a very easy way of preventing just by simple ablative techniques, wherein we just have to remove the affected portion of the cervix and we don't have to remove the entire uterus also, whereby we are preventing the formation of a cancer. Vaccination is something which is given to girls between 9 to 16 years of age group. But of late, even boys also have to be receiving this HPV vaccination. In fact, many of the Western countries have made it a policy in their immunization schedules to vaccinate both the girls and the boys. There are different types of vaccines. There are two types mainly, the tetravalent or the 4-strain vaccine, or the nonavalent or the 9-strain vaccine. The 9-strain vaccine is something which is of late launched in our country. Though it's expensive, that is the only one single injection that we have. But either of these two, a minimum of 2 doses should be given between the age group of 9 to 16, wherein first dose is given at 0 months, that is STAT, and 6 months later the second dose is given when it is given during this age group. Whereas women or girls after 16 years of age group till about their 26 years, they can still receive the other vaccines, that is the 9-valent vaccine or the 4-valent vaccine, but they'll have to take 3 doses. One now, one 2 months later, and another one 6 months later. So this is how the vaccination schedule is on. And one very welcome decision by the government of India is that they recently approved a significant share of money that is being allotted towards cervical cancer vaccination. And now our own Indian vaccine, Bharat Serum vaccines, are coming up with an Indian variant of cervical cancer vaccine. With this, we can reach out to many girls, especially which breaks the cost barrier. After 26 years also, women, especially who are married, there has been a myth that they cannot receive the vaccination, but yes, they can still receive the vaccination up till 45 years. The WHO has approved the use of vaccine till 45 years of age group for women. Whereas for boys, it is 9 to 16, for girls 9 to 16 ideal, 9 to 26 also, and even after that, up till 45 years, women can get vaccinated.